All right, thank you so much for joining us today. Welcome to Teach Facts using harm reduction for HIV prevention. I realize that this is a very specific topic, unique to what Leanna and myself do. So we are going to generalize it, hopefully to what everybody else does here, and keep it interesting and relevant to everyone. So thank you so much, Leanna. Next slide. So a little bit about us. Leanna, won't you tell us about yourself?
Absolutely. Hello, everyone. Thank you so much for joining us today. I hope everyone is having a great Tuesday. My name is Leanna Maldonado. I just recently graduated with my bachelor's in population health and a minor in political science. And I currently work as a health education coordinator at UNM Truman Health Services. I am certified by the Department of Health to do hepatitis C and HIV rapid testing. And I also run a lot of the social media for our clinic as well.
Hi, my name is Selena Herrera. I am also a health education coordinator at UNM Truman Health Services. I run a patient group called Lunch and Learn, and I support a lot of the conferences and article writing that our group does. So our agenda for the day, Leanna, would you like to do that, or should I take that?
I can do that. So for today, we're going to just do an overview of what we're going to be talking about. First, to start off, we are going to start defining the teach back and sort of break down the structure of the process throughout the teach back. Before that, my colleague will lead us in a reflective meditation exercise. And then we're going to move right into philosophy of the teach back, why we should care, why it matters, and why we should implement it in our daily practice. And then last but not least, we are going to do the teach back in action. And so we'll give you scenarios and a breakdown of how Selena and I incorporate the teach back when we're interacting with our patients. So I'm going to hand it back to Selena for our meditation exercise.
Thank you so much, Leanna. So what is a teach back? So the teach back is very essential to health education, but really it starts with us, okay? And an important part of the teach back is reflection. So we're going to start with a reflective meditation practice. So I invite everyone after this long day of sitting in front of a screen and hopefully not zoning out and trying to maintain a very engaged state, to just kind of take a moment for themselves. And I invite you to close your eyes with me. And whether you're sitting or standing, to just observe. Observe your breath. Just see how it rises and falls. In and out. Are they short breaths? Are they deep breaths? Is there something caught in your throat? Is your throat dry? Do you need a drink of water? Move your attention to your shoulders. Are they tense? Are they heavy? How do your shoulders feel? Drop your shoulders. Feel your breath. How does your breath feel now? What are you thinking? Are you thinking that you have had a long day? Are you worried that you might have left the stove on? Are you wondering if you are going to be late to your kid's soccer game tonight? You are not your thoughts. You are the person who is observing your thoughts. Breathe in and out. Take a deep breath. Breathe out through your mouth. Notice where that breath came from. Was it from the belly, from the chest? Notice and let go. Do not judge, just release. Acknowledge and let go. Check in with yourself. How are you feeling? Are you feeling sleepy? Are you feeling hungry? Are you feeling hangry? You are not your feelings. You are the person observing your feelings. Take a deep breath. Release. You are pure awareness. Open your eyes. Thank you for doing that meditation with me. So now we will move on with the presentation. So what is a teach back? So defining the teach back. Every teach back should be specific, right? So it's like throwing a party. When you throw a party, you don't just ask your friends when they ask you what they should bring to the party. Oh, bring anything. Hey, whatever you want. That's going to confuse your friends, right? They're not going to know what to bring. They might not bring anything at all. You tell your friends specifically, oh, I would love it if you brought a bottle of wine. Hey, can you bring the potato salad? Why don't you bring some chips? That is specific. It's very helpful if you give people specific directions on what to do when you want them to do things. So when you're talking to a patient and you give them a big laundry list of things that you want them to talk about or remember, you can specifically zone in on one topic and say, hey, person, this is specifically what we're going to talk about right now. This one topic, can you tell me what specifically about taking your medication on a regular basis did we talk about today? Okay, so then non-judgmental, right? So we don't want the patient to feel like they're being judged. So maybe we shouldn't introduce the teach back with pop quiz, everybody. That might seem funny to us, but to the patient, that might bring back visions of elementary school, and that might give them the jitters. Okay, so be very mindful of the type of language that you're using when introducing a teach back. Okay, so use words that are going to be open and friendly and inviting, something that's going to make people want to talk to you. Um, Definitely use words that aren't closed. Instead of do, use what. Okay. And then we want the teach back to be empowering. Okay. We want the patient to feel to leave a session after a teach back saying, like, hey, I learned something today and I feel really competent about my ability to go home and do this. Like, yeah, I can do this for myself. I can do this for somebody else. Um, this should not be something where the patient has to rely on their provider for a crutch. Why? The patient will call the provider more frequently. The patient won't follow up on their patient care, and so on. We really want our patients to feel as though they can take care of themselves, right? So yeah, thank you so much, Leanna. What's the next slide? So the 5 T's of teach backs. Before we move on, what questions does anybody have about what we've talked about so far, if any? Everybody's feeling really peaceful right now. I love it. Okay, so the 5 T's of teach backs. So of course, first we start off with triage, right? We need to assess what's going on with the teach back, okay? So because we're short on time, you want to make sure that you're picking out the most salient part of your information giving there. So you want to make sure that you're talking about what's the most important part of your session. Um, if you can get something that is essential to talk about, what would that be? Okay, so leave out all the details. What's the most important thing to talk about? If you have time, break it up into little chunks. Okay, start with the most important thing first and then break it up into little chunks and do multiple teach backs with those chunks. But don't try to do a train wreck of doing multiple topics all at once. That'll just be too confusing, and you won't have a happy patient. Okay, and then tools. So use the tools that you have at your disposal. If your patient is talking about a glucometer, you take out their glucometer and use it as you're explaining it to them. If you have pamphlets, if you have forms, take out those forms and pamphlets and show it to them. Use your hands, okay? As you can see, it's not just because I'm part Italian. I use my hands when talking to people because it shows emphasis, it shows that I'm engaged. And you know what? It's also a great tool, okay? And then there's also taking responsibility, okay? I want to make sure that I did a good job of explaining this to you. This is a lot of information, okay? It's not necessarily mea culpa, although it can be depending on your style. So, it all depends on how you want to approach it, So just feel the patient out, feel out the situation, and, take responsibility your own way. Okay, and then we move on to the tell me. Okay, this is where you can get kind of creative. Okay, and this is where this handout that I wanted to give everybody. Let's see, where's the chat? There it is. If you'll give me one moment. Here's a handout that I hope on just a few different types of strategies that you can use for yourself. When you're incorporating the teach back, there are different types of stories that you can use. Just when implementing the teach back for yourself, in your own practice. And then when you check in with the patient, if it doesn't make sense, if they're not understanding, just try again. Don't give up on the patient. Don't say, you don't understand, or that's good enough. No, don't give up on the patient. Just try again. It doesn't hurt anything. And, you want to make sure that the patient understands, and it builds a relationship, it builds a rapport, and it shows you care. So, yeah, thank you. All right, thank you, Leanna. So why does this matter? Leanna, I believe you had some excellent statistics on why it matters.
Yes, absolutely. So some statistics that kind of demonstrate the importance of teach back. 80% of healthcare information is forgotten as soon as the patient leaves the healthcare facility. And also 50% of recalled information by the patient is incorrect. So this can be really detrimental to someone, especially if the topics discussed or prevention for an outcome, a health outcome. And so this is why teach back is so critical to patient care, is that they need to understand the information that we are communicating with them when they leave our facility. And so the only way to ensure that they know what we are talking about is them explaining it back to us in their own words.
So why use the teach pack? Okay, so comprehension. As Leanna was saying, it helps patient remember and understand the information, right? That's fantastic. That's exactly why we want patients to get healthcare and come in for health education, right? It's like right in our names, like health educators, right? Okay. It's patient centric. It increases patient satisfaction. Okay, just like one of our open plenary speakers was saying, it's unfortunate that care gets split up into these many different factions, but it is a fact. Patient-centric care does exist, and this type of care does increase patient satisfaction. It is true, and we want that to happen, okay? We want people to be satisfied with their healthcare, and that is something that Truman Health Services absolutely strives for. And we hear it from our patients over and over again. Like, I love coming to you guys. And I believe it too, because we get feedback from other places, and it's not always as sparkling. So trust, it helps patients gain trust. Okay. Patients need to know that you are going to spend that time with them. Okay. They need to know that you are going to respect them, that you are going to treat them with dignity, and that you are going to be there for them. Okay. They need to know that you are going to be not just a provider, but a person. And I think that's one of the most important parts of the teach back, is that you're going to get down with them on that human level. Thank you, Leanna. Okay, so the teach back frame of mind, and then I promise I'll stop talking after this and I'll hand it over to Leanna. So the teach back frame of mind, as the handout says, low and slow. Okay, that is a technique in and of itself. Okay, take it easy. Don't try to do 3 teach backs in one session, or a teach back every single session. The first time you start at it, you'll end up tripping over yourself, you'll hurt someone, you'll just mess with your head, you'll mess with a patient's head, something will happen. Maybe all those things won't happen at all, I don't know. But just to be kind to yourself, start low and slow. It will be easier for you to go over to do it in the long run. And that's what we're trying to do, right? Is we're trying to do a practice in the long run. We're doing this as a marathon. We're not doing sprints. Okay. And that prevents not all burnout, right? Because burnout is inevitable in the healthcare industry, and it is an industry, right? It is not preventable in the healthcare industry, but you can take steps to mitigate it. So that's one of those practices, right? Low and slow. Be kind to yourself. All right. And now reflect. All right. Keep a journal, just like we did at the beginning. We're reflecting on our experiences. Keep a journal of your teach back experience. Why did this teach back work? Why didn't I use a teach back with this patient? Why was this teach back so awkward? What could I have done to make this teach back better? Why did I have to use this teach back over and over and over to get this patient understand what was not working? Doing this will help you to be more effective in your practice. And then try again, right? Try again. The only failure is someone that didn't get up and try again, right? Okay. Well, thank you, Leanna. And now I hand it to Leanna.
Thank you so much, Selena. So after Selena has talked about the structure and defining teach back and what that process looks like, we are now gonna sort of transition and switch gears a little bit and give you all insight into what we do whenever we're interacting with patients and how we use the teach back to help HIV prevention whenever we're with our patients. And so we're just gonna kind of give a very specific way that we use teach back, but hopefully that can give you all some insight on some methods and techniques that you can incorporate into your practice. So before we start, we'll just do a little kind of HIV crash course, just so that we're all caught up on the same page. So HIV is a virus that attacks the immune system. It specifically attacks the CD4 cells and hijacks them into creating more HIV viruses. It also is damaging to the immune system. And so without treatment, HIV unfortunately can be fatal. And so when it comes to HIV, there is 5 different bodily fluids that transmit HIV, those including breast milk, blood, vaginal fluids, rectal fluids, and semen, which also doesn't include pre-cum. And so as health education coordinators, when patients come into our office, it's really important that we're educating about the fluids that transmit, because a lot of people are under the impression that saliva does, and that is very stigmatizing to those who are living with HIV. And so part of our mission is to educate and then to also introduce new methods of lowering HIV risk. And so when it comes to the main transmission routes for HIV transmission, sex and sharing injection equipment, such as like syringes, cookers, things like that. Those are both high risk for HIV transmission. And so as health educators, we all know that preaching abstinence, especially when it comes to adolescents and sexual education, is not very effective. And so at Truman, we really love harm reduction. And this is the time that we spend with our patients where we're not asking them to eliminate the health behavior, because that's a lot of times not realistic. We're just suggesting and giving tips and tricks on ways that they can help reduce the harm of those behaviors. And when it comes to sex with HIV transmission, anal sex is the highest risk, just because the anus is so delicate, it can rip easier. And so our harm reduction would be trying to implement condoms, blah, 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 things like that. And so that's just kind of an insight of the HIV crash course. And then moving on, what it looks like when somebody comes into our office to get tested. they walk in, we let them know the process. It's just one finger poke, a really small sample of collection for both HIV and Hep C tests. And then during that time frame, while we're waiting for the results to process, this is where we go over questionnaire with the patients. And it basically assesses risk behavior, such as like when was the last time they had sex, what type of sex was it, do they use syringes at home for any reason? So sort of this is our time for us to uncover the risks, because a lot of times people who come in aren't upfront with their behaviors. And so it's really important for us to establish a comfortable environment for patients to talk to us. And it's also really important for us to engage in these questions so that we know what to focus on and we know what harm reduction to kind of go strategies to go off of. And so that's really important during our patient interaction. This is where we as counselors engage with the patient. And then it's very, very important because a lot of times whenever patients come in, we test all members of the community. Anybody can get tested at UNM Truman Health Services for free. And so teach back strategies are so important. For example, at the New Mexico State Fair, we had like over 400 people that we tested, and a lot of them were adolescents. So 13 to 18, we saw a huge population of that. And so it was really important for us at the end to sort of bring home the information we were talking about and the harm reduction strategies, and making sure that they understood and they could give it or tell us back what they learned in their own words, because a lot of times we won't be seeing them on a routine basis. This is since they are so young, these are things that we can help, behaviors that we can help encourage for their life. So that's why in our position, in every position, it's really important to have those teach back strategies. And just a little bit more insight of what our patient interactions look like at Truman. These are some things that we value, especially when it comes to teach back in education and counseling and health education as well. So we love to create a comfortable environment. As I was saying, it's really important that the patient feels able to speak with us about things that might be a little uncomfortable. As I said, we are asking them about their sex lives, and a lot of people aren't too upfront with that, which is totally understandable. You're talking to a complete stranger about what you like to do in bed. And so it's kind of definitely a very uncomfortable situation. And so as health education coordinators, our goal is to be as open, have open energy, no level of judgment whatsoever, very sex positive, just so that we can create that relationship and they'll be open and honest with us as much as possible, because openness and transparency leads to the best quality of care. And so that we are able to assess their risk behaviors and then go from there and strategize on harm reduction and things like that. So as I said, we are very open, non-judgmental in any way, shape, or form, trying to be very sex positive, things like that. We also replicate what terms the patient is using that helps them feel more comfortable as well. So if we use sexual encounter instead of hookup, that feels very sterile and not like a conversation. And so if a patient is comfortable saying hookup or whatever they want to call it, that's what we do as well. And then also, it's really important when we are introducing these harm reduction strategies to use third person terms instead of first person. And so if someone is saying they don't really like condoms, we wouldn't say, you should really use condoms. It would be something similar to, a lot of people have told us that if they don't really like using condoms, once they're dating someone new, they incorporate condoms. And then once they're in more of a monogamous relationship, they don't really use condoms as much. This is an example of a third person term. So it makes it feel like we're not preaching at them, but we're introducing this imaginary person that we're kind of pinpointing the situation on. And that way that person doesn't feel like we're basically coming for them, because we're not. We're trying to educate in the most delicate, most informational way possible. And then also, lastly, transparency leads to the best care. And so these are some things that we try to incorporate with our patient interactions as much as possible. And then it also really helps with the teach back, because if you establish this environment prior to the teach back, the patient is going to feel extremely comfortable asking questions when they don't understand. And you feel comfortable engaging their health literacy level. And so it's really beneficial to sort of create this environment. And we do have a quick little video about harm reduction philosophy. So I'm going to stop sharing for just a second. Okay, can we see that? Okay, perfect.
Harm reduction saved my life because it's about making incremental changes. Coming to harm reduction where the arms were open, I was comfortable talking to people about things I never spoke about in my life. I was starting to feel like a human being instead of labeled a drug dealer, a menace, a crackhead, you know. They didn't use those words to me. Spoke to me and they used my name, Terrell.
All right, perfect. So that just gives a little bit of insight on the importance of harm reduction. As I said, as health education workers, were very well aware that abstinence from health behaviors is not the most effective. And so harm reduction is a non-judgmental approach that meets people where they're at and focuses on quality life improvements over abstinence. And so it's prevention and reduction of the harm rather than completely eliminating. And this is really, really important to our counseling strategies, to our interactions with the patients, and then also eventually it plays into our teach back strategies as well. Okay, so let's kind of go over some strategies that we use when we're counseling patients for sexual health. These are things that we discuss in order to help reduce harm. So first off, we talk about condom use, how to use correctly. Condoms are 90% effective in preventing STDs, and the 10% is due from user error. And so using the correct size, the application, those are all really, really important for people to know, and also adolescents as well. So it's really, really important for us to kind of address this in that interaction. Lube, that's another great harm reduction, especially because as I was saying earlier, anal sex is the riskiest type of sex. And so with lube, it can help reduce the amount of tears and wounds, and therefore it can help reduce the risk of transmission. And then we also talk about PrEP and PrEP, the pre-exposure prophylaxis that we recommend to people who are sexually active with a lot of new partners, and then also PEP, which is for people in instances where they may have been sexually assaulted or had an instance where they don't really recall or something like that. These are both really great tools that we use to help educate and then also to help reduce harm. And then another big thing that we talk about with our patients, especially younger patients, is the power of conversation. This is something that is really important to learn, to set boundaries with partners. And so this is another great prevention method. Say if someone's uncomfortable talking with their partners about their boundaries and things like that, the power of conversation is really huge in reiterating boundaries and things like that. And then also for routine testing, this is something that we like to suggest as the patient is leaving our office. Say they were very sexually active with new patient or new partners, routine testing, and how if whether it's every 6 months, whether it's every year, that's something that we also like to speak about with our patients before they leave. Okay, so now I'm going to talk about a scenario that happened with one of our patients. And then I'm going to introduce some harm reduction strategies that we used with this patient. And then we'll go ahead and transition and see how we would use the teach back to ensure that this patient understands what harm reduction strategies we talked about. Okay, so the scenario is a 16-year-old cis male wants to know how he can slow things down long enough so he can put a condom on. So this was an issue that he was running into. His partners kind of wanted to rush the process and didn't want to wait for him to put a condom on. And so this is a risk behavior just because he was wanting to use condoms during sex, but his partner wasn't willing to wait. And so in this scenario, a couple different strategies that we introduced to this patient is we wanted to have the partner put the condoms on for him. I'm so sorry, my dog is growling and I don't know why. To the partner to put condoms on for him. This is a way to engage both partners and to sort of to kind of help the process along. And then also we introduced the idea of oral sex. Oral sex has a really low HIV transmission rate. And so condoms aren't really as necessary during oral sex. We also talked about the power of conversation with this patient, where he could reiterate his boundaries and tell his partner, hey, this is really important to me that we use a condom during sex. And I feel as though sometimes you aren't willing to wait for me to put one on. And so this is another strategy that we used. And we told him if he was okay, if he needed to practice, he could talk in the mirror or he could text his partner. These are all ways that he can use that power of conversation to help in that situation. And then also just until that partner acknowledges the boundaries and just trying to withhold sex and not engaging in sex until they are acknowledging that that condom use is absolutely necessary for him to engage in sex. So these are kind of different strategies that we introduced with this patient. And so does anyone have any ideas on teach back questions that we can incorporate to make sure that this patient understood what the strategies I just mentioned? Feel free to put in the chat or unmute if you're comfortable. Okay, so a few examples that we used in this circumstance. This first one is personally my go-to when I'm engaging with patients, just because it really brings home the strategies that we're talking about. So the first one is based on what we talked about, what is your sexual health plan moving forward? So this is a great way to gauge what strategy the patient feels like he might start doing in the future. So it can really demonstrate what he feels is a doable step and a doable life improvement that he can follow through on. And so one of our colleagues introduced us to this idea, and it is really beneficial just because it kind of demonstrates the patient's level of understanding as well as what he feels like he can accomplish. And then another great way to use this teach back is asking them to explain it to somebody else. So we would ask, how would you explain setting boundaries to your little sibling? So this would allow him to talk about the power of conversation, about reiterating boundaries, things like that. All the strategies that I mentioned before, this would allow him to explain it back to me and demonstrate how well he understood that. And then also tell me one thing you learned today about oral sex. And so these are all great strategies on ways that we would get that teach back, get that moment where we could gauge how well he understood the strategies and how well he understood the educational pieces that we talked about during the session. And I'll hand it back over to you, Selena.
Thank you, Leanna. And I'll try to keep this brief because we did have a breakout room that we wanted to do. Okay, so strategies for intravenous drug users. Again, very specific, but thank you, Leanna. Next slide. Just some brief examples. So again, taking ownership in the first example, using the friend, some syringe exchange programs are helpful for intravenous drug users in order to get syringes that are unused and available to them pretty much at they don't even have to present needles for exchange. They can just get fresh sharps. In New Mexico, at least, all they have to do is sign up for a sharps card, and they're able to get sharps at no questions asked. Okay, and then it can be awkward to ask for that first hit. So that's another way of practicing harm reduction if you are going to share needles, is to ask for the first hit and then not share a needle after that. So how would you ask for that first hit? Okay, you just got tested. You're not trying to share. That's the only way that you can share with your friend. So what are some ways you can ask for the first hit, right? Taking ownership again, I can be a little overwhelming sometimes. So how would you break down piggybacking and front loading to your friends? That's a very important thing to know. So again, that would be an example of triaging, right? If you were talking about if you had talked about all three of these different types of harm reduction techniques in one session with a patient, if you had that kind of time, that might be the first one that you'd want to talk about. So those were just some examples. Okay, so why don't we go ahead and go into our breakout rooms? Leanna will be in one of them. Let me see if I can. Okay. Oh, I wanted the breakout rooms to end sooner. Oh, okay, they're leaving. Susan, I would love to know that. So currently in the state of New Mexico, we have state laws that support harm reduction programs. New Mexico passed the Harm Reduction Act in 1997, and we recently passed House Bill 52 that kind of innovated on that. And provided for our syringe exchange programs to be able to provide fentanyl testing strips now to reduce the number of fentanyl overdoses and deaths in our state. But I know that probably not every single program in our state uses harm reduction. So I'm not sure how you can standardize harm reduction. You can't tell private organizations to use harm reduction. I mean, I'm sure there's still abstinence programs out there. And that really makes me sad. It's scary to think that there are some people who are being subjected to that. Personally, I think, because it leads to cyclical failure so many times. And And it can be devastating to families and systems, as we can see in our society. And as far as the Teach Back goes, at UNMH and UNM, the entire UNM system, the University of New Mexico, we have constant Teach Back workshops, and it really is up to the staff to take them. And it really is up to the staff to implement them in their sessions. And as testers at Truman Health Services, part of our certification process is to incorporate the Teach Back into our practice as testers. So it is a requirement in order to get certified. But once we pass through that golden testing standard and we're alone in that room with that patient, do we do it every single time? So it's really hard to standardize something as delicate as this. So all we can really do is be a care activist, like was said at the opening plenary. Okay, so we have 2 minutes. Really briefly, does anybody want to say anything about the breakout session? Just shout it out. And if not, thank you so much for your time.
Thank you all for joining us. If you have any additional questions, please just leave them in the chat or feel free to unmute and ask. I believe we only have about 2 minutes left and we're about ready to end things, but we wanted to just say thank you again for joining us. We hope everybody learned something that they can take back to their own practice. And then, like I said, with any questions, please feel free to ask. Selena also just put our emails in the chat, so feel free to reach out via email if for any additional comments, questions, anything like that.